Hello, and thank you for inviting NGPOD to be part of this event. We're excited that very soon we'll be starting 2 service evaluations through Tritech. I hope that you enjoy the following presentation and that it conveys the potential of NGPOD to dramatically change the patient safety landscape for patients who require administration of treatment through an NG tube. To put it simply, NGPOD is a new game-changing device to support correct nasogastric tube position confirmation and to revolutionise an area of patient safety that's not improved in over 20 years. I hope to take you through a whistle-stop tour of the benefits of NGPOD, briefly covering the background to NGPOD, how it works, and perhaps most importantly, the impact on patient safety, patient and clinician experience. The use of a misplaced nasogastric tube has been recognised as a significant patient safety risk for many years now. The first patient safety alert related to NGT safety was issued in 2005, and since then there have been 5 more, most recently in 2016, when NHS Improvement reiterated the need for change. Additionally, in 2009, the use of misplaced NG tubes was designated a never event, and late last year, both BAPEN and the Healthcare Safety Investigation Branch, the HSIB, issued detailed reports on NG safety, both of which detailed the considerable shortcomings of methods of NGT placement confirmation. The number of NGT-related never events reported has varied since 2009. However, since the latest reporting regime, which includes a requirement from the CQC to report never events, there has been a steady increase in the number of NGT-related never events reported. In the current year, the run rate of reporting so far has shown the same rate as in 2020 to 2021, when there was a significant rise in NGT-related never events. We should always remember that the result of an NGT-related never event is either the death of a patient or serious harm being caused. I mentioned the limitations of existing methods of NGT confirmation, so I'd now like to quickly cover these. Because of time constraints, I'll only consider the main issues. However, for anyone who wants a full picture, the December 2020 HSIB report does this very comprehensively. In the UK, there are 2 approved methods of NGT confirmation: pH testing and X-ray. pH testing is considered the preferred first-line test in most clinical situations, and currently this is carried out using aspirate from the NGT and pH test strips. X-ray is seen in most circumstances as the second-line method if aspirate is unobtainable, or if the result from the pH test is ambiguous or interpreted as higher than pH 5.5. Both of these methods have multiple well-recognised risks and problems. If we first consider the flaws and risks associated with pH testing using aspirate and pH strips, studies show that an aspirate cannot be obtained in up to 45% of attempts, which results in X-rays being requested frequently. Where treatment is time sensitive, this has an immediate impact on care. Even if aspirate can be obtained, this can take a significant amount of time, delaying treatment and using up valuable clinician resource while it's attempted. Even when aspirate can be obtained, there are significant risks, including multiple human risk factor errors that can be made. For example, choosing of the wrong pH strip, a lack of visual acuity on the part of the user, incorrect interpretation. Research shows that even in a desktop simulation, users incorrectly interpret pH strip results in 12% of cases. There's also, and because pH strips require interpretation of the colours of 3 pads on a test strip, user interpretation can be affected by the environment, lighting, as well as the visual acuity of the user. There's also a lack of confidence in people's ability to accurately interpret a pH strip, and one study showed that 32% of staff interviewed expressed this lack of confidence and anxiety about using the result of a pH strip test in order to make a clinical decision. The uncertainty of interpretation can lead to unnecessary X-rays being requested because the users are unable or unwilling to use the result to start treatment because they do not wish to risk injury or death by relying upon it. The impact of the flaws of this method of NGT placement confirmation include NGTs being used in error, unnecessary x-rays being carried out, delays to treatment which potentially lead to a negative impact on patient outcomes. If, as often happens, aspirate and pH testing results in either no result or an ambiguous one, the patient is sent for x-ray. It's important to note that the NHSI guidance states that this must be an x-ray specifically ordered to establish NGT position and should not be a chest x-ray taken for another purpose. Studies show that the highest proportion of NGT-related never events are related to the use of x-rays. This is because of human factor errors, such as the misinterpretation of the x-ray or even the incorrect x-ray being used and reported. There is also often a lack of availability of appropriately qualified people to interpret the x-ray, leading to a delay, and also, as often happens, a delay between the x-ray and the start of treatment risks the NGT migrating in that time. There are additional issues raised by this. Firstly, the cost of the procedure, reduced radiology capacity, exposing patients to x-rays on multiple occasions, and, as we previously said, delays to treatment leading to potential poorer patient outcomes. In order to appreciate all the benefits of NGPOD versus existing methods, we'll now play a short video explaining how NGPOD works. A key thing to remember about NGPOD is that while it's a new and novel method of NGT placement confirmation, it is a pH test and so can be implemented within the current NHS improvement guidance. It's just a much better pH test.
Nasogastric tube misplacement is a problem. Used to deliver medication, fluids or nutrition directly into the stomach, there is a risk the tube could be misplaced into the lungs. NHS Improvement has now issued several patient safety alerts. 271 never events have been reported associated with NG tube misplacement since 2005, with no real change in incident rate. Current first-line pH testing of aspirate is messy, requires clinical interpretation and can be time-consuming, with 18.4% of patients having no obtainable aspirate. If pH testing of aspirate is unachievable, the patient is sent to X-ray. With X-rays requiring a qualified radiographer, costing up to £100 per test and delaying patients' feed by up to 47 hours, this is hardly the best way to determine correct placement. Introducing NGPOD, the nasogastric tube placement confirmation device. Using patented fibre optic sensor technology, the NGPOD takes the pH test to the end of the nasogastric tube inside the patient, indicating correct placement or incorrect position with an LED light. A safer, quicker and more cost-effective method of confirming NG tube placement. The NGPOD will improve patient safety and reduce overall costs associated with NGT placement.
When compared to current methods, NGPOD has many advantages. The test is done at the tip of the sensor, so no aspirate is required. The only reason you can't get a test result from NGPOD is if the NGT is fully or partially blocked, preventing full insertion of the sensor. And knowing that a tube is partially or fully blocked is a useful piece of information to a clinician. NGPOD gives a result in 94% of cases, on average in 22 seconds. It doesn't require human interpretation. It doesn't become less accurate as the pH increases, and it is not affected by environmental factors which can impair a user's ability to accurately interpret a pH strip. And in addition, no additional equipment is required. The result of changing the first line NGT position confirmation test to NGPOD are reduced need for x-rays, which as we have seen are the leading cause of NGT related never events. Reducing delays to treatment, both because NGPOD is a reliable, fast bedside test and because it reduces the need for x-ray. Removing the opportunity for human factor errors to be made and increasing the confidence of users in the result. And it also reduces the cost to the healthcare system for NGT placement confirmation and releases clinician capacity both on the ward and in radiology. Thank you for your attention. I hope that this very short presentation has given you a positive impression of the benefits that NGPOD is bringing to patient safety in relation to nasogastric tube placement confirmation. and that you can see why we believe it is a game changer for both patients, clinicians and the health system as a whole. If you'd like more details, please get in touch using the details shown on the next slide. Thank you.